Now, for the next type of neurofibromatosis that we'll be looking at is the type 2. So, neurofibromatosis type 2. So, for this neurofibromatosis type 2, we are just trying to look at the disease, the symptoms, the characteristics, and all have you. Okay. So, for the neurofibromatosis type 2, you can see that I have a lot of pictures showing how this disease condition shows like. So, it's also known as what? The Recklinghausen disease, right? So it's a genetic disorder is characterized by the changes in how your skin is looking like. So the colors of your skin are changing. Do you understand? So there's growth of what? Some big bumps here and there, right? So they call them benign. That means they don't really have the capabilities of spreading. Do you understand? So these tumors arise in the nerves, in the skin, in the brain, and other parts of the body. It's caused by mutation in the NF1 gene. Alright. So what are the key clinical features? If I see somebody is neurofibromatosis type 1, how would I be able to know? Alright. So you see Kefauve spots. Kefauve spots are, all those, brown patches. Kind of look like coffee. Cafe. Alright. So frecklings. Alright. Especially, right, you can see the skin fold frecklings. Then neurofibromas, right? So you see the tumors, right? You see the tumors, you see all those lumps on the skin and all of that, So leash nodules, optic pathway gliomas, skeletal abnormalities, right? Learning disabilities. Alright. So diagnosis criteria is once you see that the Kefauve spots are up to 6 or more than 6, right? If you look at the tumor growth, right, that's like if you see all those growths on the skin of somebody, 2 or more than 2, all right, diagnostic criteria. If you see the axillary freckling, optic gliomas, if you see leashed nodules, all right, you see leashed nodules that's in the eye. If you see it, they said how many. If you see it's 2 or more, all right, all this will help you to actually diagnose. So complications, that's like if you don't treat this disease, you leave it, you can actually get to a worse state. Okay, so it could cause malignant peripheral nerve sheath tumors, hypertension, seizures, brain tumors may also occur, psychological impact. Do you understand? So it's affecting how the person is thinking and all of that. All right. So inheritance is what? Autosomal dominant. All right, autosomal dominant. So that's it for neurofibromatosis type 2 pathology.